The blood of the mother and that of the fetus should never mix. Hello my dear students, I am Dr. Vaishali Bharambe, Professor Anatomy. What is this placenta? Today is about the placenta. This is part 2 of the lecture. Let's begin to understand the placenta. You can see it attached to the maternal endometrium. It has a fetal surface towards the fetus, a maternal surface towards the mother, and an edge or a peripheral margin. So what is this placental barrier, ma'am, you keep talking about? In the early months, placental barrier is a tertiary villus. Now, as the size of the embryo increases, you can't have four layers. So what happens? There is syncytial trophoblast and there is endothelium or fetal blood vessel. So let's finally come to understand what exactly is placenta doing. It acts as the fetus's lung, the fetus's gut, its kidney, its endocrine gland. This is an important function, please note. It is able to cross into the embryo immunoglobulins. Which ones? IgG. But there are some immunoglobulins it does not get from the mother as they do not cross the placental barrier. Let's think of a clinical case when the baby is born low birth weight, hepatosplenomegaly, microcephaly. Mother gives history of a mild flu-like illness in pregnancy. Immediately there is suspicion of congenital cytomegalovirus infection. So what do? You perform tests for IgM antibodies in the baby's blood, which turn out to be positive. What does presence of IgM antibodies in the newborn indicate? The answer is C. Fetus was infected in utero. Fetus developed its own IgM to fight it. So rubella can easily transfer into the baby, resulting in a condition called congenital rubella syndrome. There's a novel by Agatha Christie called The Mirror Cracked from Side to Side, in which there is mention of such a case where the mother, who is an actress, catches infection from one of her fans, and that happens to be rubella. There was a drug created called thalidomide in 1950s, which was used to treat morning sickness in pregnancy. This crossed the placenta and had a major effect on limb development of the embryos, resulting in embryo with such maldeveloped limbs. Let's come to the applied importance of placenta. Depending upon the attachment of umbilical cord, you can have a furcate placenta when the umbilical cord divides early and there are separate blood vessels entering individually into the placenta. My dear friends, if you like this video, do please like, share and subscribe to my channel and hit that bell icon.